AFMC is really known.
And also make sure
Hello and welcome into this week's edition of AFMC TV. We're so glad you're joining us. You know, have you ever had the thought of when there is normal forgetfulness, what is the difference between just forgetfulness that comes with age and when that could be signaling that there's something a little more concerning going on? Joining us today to answer that question is Dr. George, one of the associate professors at the Department of Geriatric, right?
At UAMS.
At UAMS. Yes. Okay. Thank you so much for joining us today.
Well, I'm glad to be here. Thank you for having me.
So we will just kind of jump right in. When is it normal forgetfulness versus it might indicate there's something deeper going on, potentially?
That's a great question, and that's a question that a number of my patients as well as their families have for me as well. All of us are going to have cognitive aging. Okay. You know, when we're 4, we learn our languages so much quicker. Everything is quick. But as time goes on, we become slower in learning new things, and cognitive decline happens for our older adults. And as we age, it's going to be difficult for us to learn new things, remember new things, operate a new remote, and so on. However, cognitive decline is different from dementia. Most older adults, even into late 80s and 90s and beyond, are able to be functionally independent if they don't have dementia, which is memory loss to the extent that it affects a person's ability to function and do the things that they need to be able to do to live independently. Okay. So it's a transition more than a black and white, and there's a lot of gray zone there. And there is the challenge and there's the opportunity.
So let's go ahead then and level set on maybe the difference between dementia and Alzheimer's. If you have dementia, do you have Alzheimer's? If you have Alzheimer's, do you have dementia? Do they go hand in hand, or are they fighting cousins?
Actually, you know, that's something that we struggle with as well, to understand the difference between all these terms that we have around memory loss. Yeah. So dementia is cognitive decline or memory loss to the extent that affects a person's independent living. And Alzheimer's is the most common form of dementia. Okay. So Alzheimer's is a form of dementia, and the most common form, most of the memory loss happens actually after the age of 65, and the incidence of it doubles every 5 years. So old age is the biggest risk factor for developing any kind of memory loss. Alzheimer's is the most common one, and is followed by vascular dementia, which is related to stroke. Okay. Then Parkinson's, Lewy body, and various other conditions can cause memory loss and dementia as well.
So as an adult child, and during the holiday season, maybe spending time with parents or aunts and uncles that are over that threshold of 65. Right. What are things that we could be looking out for to determine if there needs to be a gentle, sensitive conversation with a parent or an aunt or uncle to begin to kind of assess what exactly might be going on?
I like that you use the word gentle and sensitive. Yes, they're so important. Because, you know, it's embarrassing to bring to somebody's attention that I think you have memory problems. And some of my older adults and their families are very open about it, and, you know, they have some insight into their limitations. They're willing to have this conversation. Sometimes they're not. So assessing that readiness for that conversation is so important. And if they're not ready and if they're not willing, it's important to maybe just talk to somebody who's closest to them to bring it up. So the earliest problems that we see are with executive functions. So this is something that has to do with complex tasks such as managing finances, driving, taking their own medications. And if somebody does not have insight into their limitations, they may actually be doing these things wrong. Okay. And that can cause a safety issue for themselves as well as for others. And then what we may see socially are things like repeating themselves, or which relative has we not had repeat their big story for the nth time in Thanksgiving. So some of it, is just humoring the older adult, and some of it is actually, okay, you've asked me that question for the third time in 5 minutes, so there's something more. So we have a simple questionnaire called 88, or a dementia questionnaire, which families can Google and look up. And this is not just for the older adult, but also for families to go, okay, so these are ways in which we're noticing these memory gaps, and may be able to bring it up to sometimes the doctor is the first person to address this. So a family can contact a doctor and say, we're concerned about their memory. Can you address this at a visit, and schedule a visit so that the doctor can be the bad guy?
Yeah, that's good. And it's great that there's a tool out there that can kind of guide families into having a conversation if they feel they want to have that conversation, and then not leave it up to the doctor. I'm curious, what services does UAMS provide in this delicate realm?
Well, we have, a primary care doctors who are usually the first people that families have a relationship, and they can definitely address it there. Then we also have geriatricians who can guide the more complex decision making of, we can order tests to see if an older adult is safe to drive, and help increase the support at home so that older adults can be independent in their own home for as long as it is possible to safely do so. Yeah. We have social workers, we have neuropsychologists who can do more complex testing beyond the in-office quick screening tests that we can do for memory loss. We have imaging centers that, we sometimes order sophisticated imaging to rule out as well as to diagnose memory loss, neurologists. So any service that an older adult or a family may need with memory loss and navigating those challenges, we are able to provide at UAMS.
That's fantastic. And we are, at this point in time, this is something that would impact someone over the age of 65. We're not seeing any indication of dementia or early Alzheimer's in younger individuals, right? We're still kind of categorizing this for an older population.
While it is predominantly a disease of older adults, there are conditions that predispose a younger person to developing memory loss. Okay. And, people, for example, with Down syndrome develop dementia, Alzheimer's dementia a lot earlier. Okay. And there could be other conditions that could also cause dementia, such as frontotemporal dementia, which is typically seen in younger adults. Okay. So any kind of memory loss that we suspect could be impacting someone's ability to function independently, it's best to talk to the primary care doctor or geriatrician and, get the testing needed. And sometimes there could be conditions such as depression, thyroid issues that can, cloud or coexist with dementia that could be diagnosed and treated. And, memory loss can actually be reversed in those cases.
Okay. Well, that is something I did not know. So let's talk then, this is a great segue into just some of the advancements in treatment that UAMS is on the forefront of.
So, the common medications that we use are to help with the ability of cognitive processing so that an older adult is able to communicate and be independent in the community longer. Mm-hmm. So the category of medications we would use are the acetylcholinesterase inhibitors. And that's where, we start. And then there are other medications that can be used for neuroprotection and some behavioral issues as well. Those would be in the NMDA antagonist categories. And there are several medications that are being developed to address dementia at an immune level. And they're still being developed for this.
That's exciting, though.
It is.
That there could be a possibility there for something.
Well, I would think of dementia as not as something that we can diagnose, treat and cure, but almost like a chronic disease such as hypertension or diabetes, that if we get diagnosed, then we know what to do to take the right steps to improve our ability to manage the disease and have a great quality of life, not after we cure the illness or after we find the cure, but alongside and make the best out of every day.
So in thinking of it, in reframing it in that context, then we know as it relates to hypertension and diabetes, what we can do to not find ourselves with hypertension and diabetes. Are there things that we can do as younger adults to better set ourselves up for the future and maybe not have to go down that path?
Great question. Again, anything that is good for the muscle and the heart is good for the brain. Anything that improves the circulation, anything that improves the brain's ability to invest and learn new things. So novelty is very important in terms of keeping something fresh. So, along with, first, if somebody's smoking, please quit smoking.
Sure. For multiple reasons.
Yes. Also, increases the risk for memory loss. Managing chronic problems like diabetes, high blood pressure, managing weight, and then, exercise, nutrition.
Yep.
And keeping your brain sharp, learning a new language, dancing, cooking, just doing something different, enjoying, volunteering.
What about like crossword puzzles and things of that nature?
Yes, those
Can
are
that help
good.
too?
Absolutely.
Yeah.
But, doing crosswords makes you better at crosswords. Doing life makes you better at life.
Well, you can make an excellent point.
Right. So, trying to be as active and independent.
Sure.
I was just talking to someone who spends a lot of time in bed, and I was like, when you go to bed, just go there only when you want to sleep. And because, sleep is important.
That's
Mental health is important.
That's
so
right.
managing all of those.
In our remaining moments, if someone is watching or listening and let's say they are hypertensive and they are diabetic and they have a couple of these things, that doesn't necessarily mean that they are going to develop. Correct?
True. It's like smoking and cancer risk. There are people who don't smoke who also develop those issues. So what we can do to protect ourselves is to have a really healthy lifestyle, and if this is happening, to get diagnosed and treated early.
And my last question, is there a genetic link if parents or grandparents suffered from dementia? Does that mean that it's going to be passed down generationally or potentially?
Potentially, but there is a lot more that we can do lifestyle-wise that can negate that risk. So I would not think about that as somebody's destiny.
Yes.
It is just a possibility. But with better lifestyle changes, we can definitely overcome that.
Okay. All right. Dr. George, thank you so much for joining us today.
Thank you for having me.
And thank you for joining us. We'll see you back here next week for more AFMC TV.